October 18, 2021 marks the 5th anniversary of the agency leading the fight against infectious diseases. On this day, a new Director General formally resumes as the centre's pioneer Director General, Dr. Ihekweazu, bows out. Ihekweazu, who is going to assume the duty as the Assistant Director General for Health Emergency Intelligence at the World Health Organization, says there's no better person to lead the young agency than his successor.
When we started in 2016, there were many people who questioned the scale of our ambitions, who suggested that our system cannot accommodate big plans. But there were also people that believed in us and gave us a chance. Critically, you, the Ncdc team, and many other of our partners and friends, collaborators in this room, and some who have left Ncdc since, have shown that everything is possible if you believe you're on the right path and you keep pushing forward. You have demonstrated what is possible when a group of people come together to deliver on a vision supported by an environment in which they can learn, thrive, and grow. But to be honest, the future was not always so bright. I recall many of the challenges when I started early on. I had assumed, rather naively, when I was appointed, that everyone wanted this young agency to grow. Sadly, this was not always the case. Sometimes in those early years, I felt like a caregiver of an unwanted baby. It felt like this baby was itself being deprived of the nourishment it needed to grow. I am deeply grateful to our partners for all your support, to other government MDAs, other national public health institutes, the organized private sector, religious and traditional institutions, and the media. To all of you, I say thank you. Thank you very much. My brother, Ihekweazu Adetifa, will find in you an excellent team. I urge you to give him the same support and even more that he gave me, as he takes Ncdc to even greater heights.
And as the country continues to battle infectious diseases, including the COVID-19 pandemic, the new Director General declares his plans for the future.
The Ncdc, as Nigeria and West Africa's sort of foremost national public health institution, has been clearly articulated here in various ways, has worked incredibly since it was set up, and particularly over the past 5 years, to fulfill one basic vision, which is a healthier and safer Nigeria through the prevention and control of diseases of public health importance. And even from the sidelines and way back in time, before a day like this, when a day like this didn't actually seem to be an option in my future, I'd watched the Ncdc progress. I'm incredibly proud, and to be honest, also challenged by the work that has been done in the last 5 years, particularly by the speed at which capacities have been built here at the Ncdc, all due to the leadership provided by Dr. Ihekweazu. I hope to be able to bring my knowledge, experience, partnerships, and the networks I've built over the years to the Ncdc, and to collaborate with you all to sustain the gains that have been made so far, and more importantly, to work with you all to take things a few notches higher.
Development partners had all glowing words for the young agency, which is leading the nation's fight against infectious diseases, as well as for its outgoing Director General.
Chikwe and the institution that you have built. You have led your system to the UN. I don't know how many times we met at the UN house. 4 times, more. With the entire UN system, we invited our diplomatic partners. You led a charmed offensive to convince us of your agenda for this country. And you negotiated hard for Nigeria, and you never compromised.
I wish to congratulate once more the Ncdc for a successful 5 years in invigorating all levels of government to effectively prevent, timely detect, and control many health security threats that have occurred.
Been a great pleasure to work with him. One of the first engagements that we had with him was to agree that we're going to send a clear signal to our teams that we're working together, and as two very critical agencies, that we will work together no matter the situation. And that is how we have carried on, and I know those sentiments have really trickled down the rank and file of our agencies. In as much as I will miss Dr. Ihekweazu, I've always thought that because people like him are so rare, and because of the times that we face, if I was president, I will probably not let him go. I will make him an offer that he cannot refuse.
The ceremony also celebrated the remarkable transformational journey of the Ncdc in implementing its 5-year strategic plan for national health security in line with its mandate to lead the preparedness, detection and response to public health emergencies.
We have led outbreak preparedness and response, and even much more. In the past 5 years, Ncdc has grown tremendously by building systems, building an institution, building a people, building capacities, and building trust. We have built public trust.